Welcome everybody. This is Lessons from the Field, and this is a series of interviews that we do with a diverse array of guests who have a common thread, and that is a passion for pharmacy and pharmaceutical sciences. And today we're featuring Russ Secter, who is a graduate from 1978 from the UIC College of Pharmacy. And Russ has a very interesting career history that he's going to describe for us, both in hospital pharmacy and mostly in pharmaceutical industry. He's currently CEO and founder of My Back Nine, which is a consulting company for pharmaceutical industry. So I'm sure we'll hear more from Russ on the name of his company. And I did see a video of Russ recently playing golf, so I know there must be some reference to his golf game. But Russ, thank you so much for being on today. We're going to go through a series of questions, and I know that the inside experience that you have is going to be really valuable for the folks who will be listening, students, alumni, and friends of the College of Pharmacy. So why don't we go ahead and get started, Russ, and if you could just start with just an introduction to your career, kind of walk through the timeline for us briefly.
Sure, and if you don't mind, if it's not too boring, I might start with getting to pharmacy school.
Absolutely, yeah.
There's some themes in my journey that kind of continue to play out and play out and play out. I worked in high school, I worked in pharmacies forever. And I only had one other job that was as a caddy. So you can started early in that sport. Yeah. But I wanted to be a retail pharmacist. Now remember, this is in the early 70s and 60s. And retail pharmacy was way different than it is today. I wanted to own my own drugstore and do that. And I worked in those settings. And it was really a great learning environment. And I wasn't even in pharmacy school yet. And you fast forward a little bit, and I got to pharmacy school. I'm in my last year. Again, the curricula was a little bit different back then. I'm in my last year, which is when we did all of our clinical rotations. And clinical pharmacy was just starting to scratch the surface of mainstream, or at least, yeah, I think I would say that, of mainstream, very, very early stages. And I got turned on to the clinical practice by one of the faculty at U of I, Tobier, who just opened my eyes to some new thing. I was not expecting. I was dreading it a little bit because I didn't think I was smart enough to function in that kind of an environment. And after that, his experience with me, I took all electives, and it just so happens that they were two folks, PharmDs, that came from University of Missouri, Kansas City, which is where I ultimately went to PharmD school, and they pushed me to do that. But it was after the application period was over. Well, they pulled a couple strings to allow me to get at least my application in. So I was really lucky, and that's the first thing I kind of want to say. Being lucky and being at the right place at the right time has done a lot for me as I in my career, being at the right place at the right time. So anyway, I was fortunate enough to get into Kansas City and saw high level clinical practice, probably as good as anywhere else in the country. And I started thinking to myself, is it real? Can it be done in the community? I still had that kind of community base, wanting to do things like that. And so rather than go look for a job at a university as an academician, I looked for a job in the community where I could practice and teach other pharmacists that didn't have PharmDs, because back then they were separate degrees, to do higher level clinical practices. And I was fortunate enough to run across somebody who had their PharmD, but did not want to do clinical practice, wanted to run interference for somebody like me, happened to be in Madison, Wisconsin. And I went to work at a small community hospital there, Madison General Hospital, and created clinical pharmacy services. They may sound a little old school, but back then I created the aminoglycoside dosing program, patient education with materials. I hired a drug information pharmacist, and we created a drug information center. We had a pediatric person, somebody who was interested in neonates and pediatrics. I developed a practice in nutritional support, and we had a hyperalimentation team, nutritional support team, and it was really a phenomenal thing. The other thing that happened at that time, from a healthcare standpoint, is that home healthcare was starting to become economically an important thing, and from a patient standpoint, a good thing too. And I knew, because we were doing it, home TPN, home antibiotics were big components of any home care program. But I knew there had to be more, at least I thought there had to be more. And when I was doing my nutritional support rounds, I'd go through the various places in the hospital and look for these things. Right? Somebody, a friend of mine, said, yeah, he was a respiratory therapist. We do this in respiratory therapy all the time. Oxygen stuff and apnea monitoring. It's, again, different than it is today. And there's something called durable medical equipment that's a big business. So we kind of strategized and put together a proposal for the management of the hospital and said, we need to create one of these programs. And they did. And that was my first foray into business. He was the president of the company because I was just a clinical guy. I had no formal training in business whatsoever. I never took a course that wasn't pharmacy or science related. And I was everything else. And we started, for me, I was, quote, selling. We'd go to small hospitals in Wisconsin, and I would show them how to take care of nutritional patients that needed nutritional support. I'd create their protocols, but I would manage the patients clinically. And that started this business rolling, but we started making money, and I didn't understand that concept of making money. I'm a pharmacist. We didn't make money. There was no reimbursement for pharmacy services or anything like that. And as I started getting into the business side of things, I saw that I didn't know anything about business. So I went back to get my MBA, and I drove down to Chicago every weekend. I got the executive master's program back then, and never looked back because business was started to rekindle the different passion in me. I did not want to lose my pharmacist background and my pharmacy ties. So I started in the pharmaceutical industry. I worked for Novartis, but it was Ciba back then. I worked for Searle, which became Pfizer. And I worked for a small startup company called Aura Pharma that was purchased by J&J. When we were purchased by J&J, and I was focused on marketing and mostly marketing and a little bit of sales. I was VP of sales and marketing when we were acquired. That company was acquired by Johnson & Johnson. They made me president. That was about 2003. And from that point forward, I started on basically senior management of companies. That was a $100 million company, which is small by any standard. But from there, we sold the company for J&J, and I started getting involved in startups. And that's what I've been doing ever since. Some work, some don't. My back nine, the last startup that I was CEO of, we actually ran out of money. It's not always, it doesn't always work. Things don't always hit. We ran out of money, and I was getting older. And I thought maybe this is a way to wind down. I did not want to have a company that was the 19th hole, because that means everything is over. But anybody that golfs knows that the back nine is the second nine, and you kind of start over. If you did poorly on the front, it doesn't matter. You're going to start all over again on the back, and become this kind of consultant. I specialize in some areas, and I do a lot of work locally with startups at accelerators and incubators. And it's my way of starting to give back a little bit, some of my knowledge and education.
Wow. Well, thanks for that. In a few minute capsule of your whole career, really, I think, what you what you did at up in Wisconsin probably continues to this day. I know that that hospital, which has been changed names a few times, but still has a really good clinical program. Probably some of the programs you even started there are still in existence.
Yeah,
Maybe the residency program.
and I'm still friends with some of those people.
Oh,
So
good.
I have an inkling, but the thing for me that's the coolest thing, and maybe that's part ego. I guess you can't be a clinical pharmacist without having a little bit of an ego. But we ran the home healthcare program out of a retail pharmacy. It was interesting. I recommended buying a retail pharmacy. The hospital bought the retail
Oh,
pharmacy,
wow.
and we ran the DME business out of that, the home healthcare business out of that, nursing home consulting out of that. That was, again, back in the 80s. It grew and it outlasted me because I was long gone by then. But I come back to Madison every year, and along the Beltway, if anybody knows where that is,
Yeah.
I was this big glass, or is belt line along the belt line, this big glass building not too far from where I used to live, that it had said Meritor Home Health across the top. It now says Unity Home Health or something like that.
Wow.
But it lasted, and
Yeah.
that's kind of a cool thing to see. You have a little bit of an imprint there.
Right. That must make you feel good.
Yeah,
Yeah. And
yeah.
your career in industry, and the different companies you've been with, I mean, the experience that you got along the way and everything is just phenomenal. So let me start with the first question then. I mean, you obviously have a impressive journey, but maybe you could just highlight for us over that time, what are some of the things that gave you the most personal satisfaction?
Yeah.
And what would you recommend to listeners with regard to that?
Well, the ego side of me, I kind of just told you, to see the things that I've done last.
Mm-hmm.
And that comes from some pharmacy and some not pharmacy, because you can make an impact on taking care of patients, and you can make an impact on business and the communities in which the businesses serve. And they're two very, very different things. The one thing that I remember in my residency program, we took call every fourth night with the house staff. We went to all cardiac arrests, any drug overdose, and unfortunately in Kansas City, there was a lot of them, and motor vehicle accidents and the like. And the klaxons go off, and you get out of the little cot you're sleeping in, and run to wherever they tell you to go. Well, the labor and delivery had, the button was really close to the woman's head, and it got knocked all the time. And kind of, we, like the boy cried wolf, you just took your time getting to labor and delivery because it was never a code, it was something else. But you still got to go. So one night that happens, it's 3 o'clock, literally 3 something in the morning, and I was the first one there. And I got a little bit of a history. It's like, what's going on here? And they said, well, we were going to give this lady an episiotomy, and she stopped breathing. And I'm sure everybody listening knows, the lights go on in my head. I said, did you give her some pain medication before the episiotomy? Yeah, we gave her 50 something of Demerol. And of course, narcotic overdose, Narcan, boom, and she's fine. I saved that lady's life that night. And nobody else that was there had the wherewithal to do that. I might come back to that later about what we know as pharmacists and what make us truly, truly unique in the healthcare system. But that's one of those pharmacy, those kind of use your education. Nobody else could figure it out, and I did, and we all can, and we all do every single day.
Yeah. Wow. That's a great story.
And then on the capitalistic side of things, like you said before, having the home healthcare business flourish and grow beyond my presence, it was like, dropping some seeds and starting something, and people thought that it had value over time, and they kept it. And yep, it's probably making a bunch of money, but it's also taking care of patients in an environment that's much more conducive to recovery than a hospital or whatever.
Yeah, so whether you're saving one person's life or helping, thousands through the company,
Yeah.
definitely a great impact. I guess the next question is, was there kind of a Eureka moment that you had during your career, or sometime where you, just suddenly woke up and
Yeah.
decided to change directions or,
Yeah. Yeah.
or change?
Well, the the latter first, you just have to be in the right place at the right time, and you have to be willing to try stuff. And I've been lucky, like I said earlier. But the Eureka moment is like, um, and this happened when I was a pharmacy undergrad pharmacy student. It happened as a PharmD student. It happened as a PharmD resident. There's so many smart people around you, and I always felt like I can never do this because there's so much smarter than me. And now here I'm going into business with, yes, an MBA from a great school, but no experience like anybody else. But and people said, how the hell did you get into business? But if you think about what we learn as pharmacists, and I think you guys, the university calls it something different than when I was a student, but etiology, pathophysiology, acute treatment, long-term treatment, and monitoring parameters. You do that for every patient that you see when you're taking care of them. I think, like I said, you call it something different. Well, that's no special thing for solving a medical problem. You solve business problems exactly the same way. We had a manufacturing problem in one of the companies I was CEO of, and we couldn't figure out what was wrong, why we couldn't automate this process. And I don't know anything about manufacturing, but that's the process I use to solve the problems, or to try, because not every story has a positive outcome. That we never solved the problem. That was in 2009, I think, and I stay in touch. I do some work for that company today still, and they still haven't solved that problem. But etiology, pathophysiology, acute treatment, long-term treatment, monitoring parameters, you tweak the words a little bit and you solve business problems like that. And
Yeah.
when I realized that, it's like, okay, I got this. I know how to do this.
Yeah, that's so true. Yeah, I mean, I'm glad that you pointed out, sometimes it's just by chance, and sometimes it's more by design. But I think every person that I've interviewed has pointed out that opportunities come up, and sometimes you do have to put yourself out on a limb a little bit, take a risk, and
And sometimes you don't even know that they're opportunities. And I don't mean that facetiously. It's
right.
just somebody comes up to you with an idea or something like that. As an
Yeah.
example, not that you asked me, but I'll take advantage. I My first startup was, I got a call from a colleague, somebody who was a colleague. I used to work for the guy, and he said, "Do you know any junior marketing people? We are getting ready to launch our first product in this brand new space." And he told me a little bit about what they had, and I said, "This Joe, I don't know any junior marketing people, but I know that you're launching this new company's first product. You want somebody experienced, not somebody new. And if you agree with that, I know somebody who might be willing to do that." And I raised my hand, and that's what started me into the startup world.
Oh, wow.
And I hadn't looked back, but because it seemed like I made it an opportunity, because I saw that there might be something that I would like to do and would be fun. So sometimes opportunity comes to you, but sometimes you can take a situation and make it your own
Right.
opportunity.
Yeah, that's great. Yeah, I mean, it obviously took a risk by going from corporate
Yeah.
corporate scene to startup, which is a little bit more tenuous, but has a lot more reward probably.
Yeah.
Well, I think that this next question is one that you answered a little bit already when you talked about the patient, the OB patient, but
Yeah.
I think maybe the question is designed to be a little bit more broader. But as pharmacists, or as a pharmacist, what is the most significant impact, do you think that you have had or that we can have?
Yeah. Some things change a lot over time, and some things I don't think really do. And this is one of those things that I don't think really really changes over time. Impacting people's lives in a positive way, which is really what we do. Whether you do it in the corner, at CVS, or you do it in a hospital, or you do it in the pharmaceutical industry, that's really, I think, the name of the game. And you gotta be, I mean, how can you not get excited by that? The other thing, and I'm not sure if this is exactly what you're asking me, but I will reveal kind of part of my geek side too. Never too old to be geeky. And if you look at comic books and pick your Marvel, DC, or whatever. I know I'm dating myself. Pick your superhero: Iron Man, Black Panther, Black Widow, not so much Spider-Man, but Superman. These are all the Hulk. These are all great superheroes that will come and help out your malady and save the day. Any one of those people will do. You don't really care which one comes to help you. But as pharmacists, we have our own superpower. We know more about drugs than any other healthcare professional. No other healthcare professional has the in-depth knowledge of drugs and therapeutics that we do. Yes, cardiologists know a lot about 7 drugs, or that's not fair, but 20 or whatever the number is. But nobody has that knowledge in the healthcare arena. We do. And no one's going to get that. No one can ever really take it away. And so for me, that's one of the things that makes pharmacy really attractive, because unless AI changes that, and that kind of keeps me up a little bit at night trying to figure out, is that a threat at all?
Right.
But I don't see that changing. And it gives us something that nobody else has. It's our superpower.
Yeah, wow, that is awesome. Especially with next month is National Pharmacist Month. I think the headline should be Pharmacist Superpower.
Yeah.
I could see some great social media posts with that. If you don't mind, we're going to use that one.
It's copyrighted. Don't worry. No.
So we have students listening, young alumni that are maybe just out of the program and starting their careers and faced with different options and choices that they need to make. I wonder what advice you would give to those kind of folks, given all of the experience that you've had.
I think that I look at it a couple of different ways. You can practice. I equate it to running, because I used to run with my head down, and my wife told me I look really old and I should start looking up when I run. And when I run looking down, I can see holes in the road, ice, puddles, whatever, snow. And so I know I'm not going to fall and get hurt. Or if I run looking up, it's different. My balance can get screwed up. I might, step in a big water puddle, whatever, trip over trees. You can practice with your head down, and I don't mean that in a derogatory way. You practice pharmacy the way you were taught to practice pharmacy, and you wind up doing things like saving that lady's life in the code, because you can do that and nobody else can do that. And you practice traditionally with your head down, and that's a great career. There's a ton of things that you can do and get great satisfaction. That's a path. Another path is to practice with your head up and take a look at the external environment and see what's out there, not see what's out there, but understand what's out there that you might be interested in, that your skill set can make an impact on, or that you might even like to do. And you, like I said a second ago, you can create that yourself or take advantage of it when it comes. It's not bad to be wrong, as long as you know that you're wrong really quickly. You don't want to be wrong take a long time to figure that out. And when I say wrong, I don't mean the wrong choice of drug. I mean choosing a path that's not right for you. There's so many, so little that's 100% irreversible. And this is one of those. It's not.
Yeah, wow, what another great quote. I'm taking notes here. I don't know if the head looking down, head looking up is also copyrighted, but that is excellent advice. I think of pharmacists always I think typically pharmacists are looking down, right? We
Mhm.
we're kind of trained to be safe and
Yeah.
low risk takers. We want to get the job done and we want to help people out, but
And that's
looking,
okay. That's a
yeah,
great,
there's
a
nothing.
lot of good things happen there. Yeah.
You may miss opportunities or another path that you could take because you're busy looking down. So
Yeah.
great advice.
As kind of an example of that, when I was at SIBA, I can't say Novartis, I'm just not able to do that. When I was at SIBA, I started market research. It was my first foray in the pharmaceutical industry. And everybody wants to get into marketing. That's the whole idea. And to get back then, to get into marketing, you had to go do a sales rotation, which I dreaded. Going in, knocking on dice, knocking. I was the guy that wouldn't let him in my office at Madison General. So now I'm going to be one of those guys. It's like, oh my God, karma is I'm getting set up for that. But you had to do it. Well, most of the people in my little peer group lived in New Jersey and had families and whatever, and they didn't want to leave. They had to wait for a local territory to open up. Well, the head of marketing who makes these decisions had an opportunity in Las Vegas. So again, I'll go. And I leapfrogged, whatever the past tense of that, leapfrogged over probably 15 people that needed those experiences. And the next thing I know, I'm getting my sales rotation and I'm in product management, marketing, doing the thing that I wanted to do all along there. So it's one of those things that put yourself out there to take advantage of what's given to you or offered. Yeah.
Absolutely. Okay, so let's see what we have next in terms of question is maybe turning that one around a little bit. Either maybe the best tip or
Yeah.
best advice that you personally got, or maybe more along the lines of outside of your career necessarily, but
Yeah.
a tip for success in work or life in general.
Yeah. I don't even know if this was a word. You know how words kind of come into
Yeah.
popularity over time. I don't know that this was even a word back when I first started, which is sad. But networking and keeping a network and staying in contact. I wish I would have known that back in pharmacy school. I mean, it puts Facebook and all of that. It's the practical application. I'm not talking about LinkedIn. I'm talking about having relationships with people and staying in touch one way or another, because you never know when you're going to need them or when they might help you or vice versa. And it's really it's an enriching kind of a thing. My first boss at SIBA taught me that, and I stay in touch with him yet today because of him teaching me that. And he's way even older than me, and he still reaches out to people and talks. He tells me who's doing what to whom. And I wish I had contact with some of the folks that were in my pharmacy school class or that I was in product management with at SIBA or anywhere in between. That's something that I would encourage people to do. It's not just having the network, but it's staying in touch. A quick email or a call or text, I guess nowadays, or a TikTok video or whatever.
Maybe not TikTok.
Yeah, right.
Oh yeah, it's such great advice. It's something we also have heard from a lot of the guests that we've had. But the importance of networking, yeah, can't be overstated.
Yeah.
It's one of those things I think that, especially when you're a student or early in your career, you don't realize the importance of quite as much, even though people tell you. It's one of those things you kind of have to experience, get the benefits from at some point to realize, that yeah, that actually these things do come around. These folks that you've created relationships with, can put you in touch with others or create opportunities for you, and it's just so important. So thanks for pointing that out again.
Mm-hmm.
So Russ, this has been great. Maybe just as we finish this up, if there's any last minute advice you want to give to pharmacists that might be starting out or anybody listening, maybe we have some of your old classmates on the line now that you want to get in touch with again.
I touched on it before. You've got so many paths available to you to choose from as you go forward in your professional career development, and just keep an open mind. Head down is great. There's nothing wrong with that, but peek it up every so often and seeing what's around the corner. Maybe you can do unto others before they do unto you. You get ahead of the curve. You get ahead of the curve that way.
Yeah.
I guess would be the thing.
Well, you're certainly a great example of that, and we appreciate you spending the time to share with us a little bit about your career and advice and tips for people along the way. So, thank you, Russ.
Yeah, it was fun. Very much fun.